think the biggest barrier for underserved patients to enroll into clinical trials is actually where we open those clinical trials. And so the problem is that we don't have places that have open enrollment of clinical trials in places that underserved patients live. As we all know, clinical trials usually require a little bit more monitoring than classic patient treatment interventions. And if we don't put clinical trials availability in places that people actually live, so they don't have to, commute so far to urban environments, the enrollment to a clinical trial is just not going to be representative of the entire population. Additionally, the other barrier that I just mentioned is the common visits that are required within clinical trials. And so I am a firm believer too that if patients are enrolling on clinical trials, they should be endorsing some sort of travel reimbursement that is either paid for by the company that is sponsoring the trial or the center that is enrolling that patient to the trial to make it more conducive for patients who are living in underserved areas to be able to come to the center and actually participate. And another thing too that also leads into this comment is that oftentimes patients who are underserved and minority are working hourly jobs or jobs that they're not salaried that they can just take off at any time to come and do that visit for that clinical trial. So I think number one, as I pointed out, is that we don't open trials in places that are more minority present and underserved. And we need to make it easier for those patients to enroll. So that way we can get them onto the studies. That way our treatments do become representative of the population we're treating.
Yeah, I agree. All of these things that can be, each one of these things that can be barriers to us to joining a study kind of hurts accrual or provides a disincentive for patients to enroll regardless of social status or anything. I suppose there's a little bit of complacency that for most of our patients, the standards in the first few lines of treatment are going to be effective. So I think when we start adding barriers, whether it's the number of visits or certain lab parameters, or sometimes even just the number of scans, it gives some patients pause before enrolling if they don't feel totally committed to the trial that they're looking into.